Hello and welcome to Table Talk during our Food Allergy Month. My name is Joni Rampolla, one of the registered licensed dietitians with Giant and Martin's, and I am so excited to welcome back to Table Talk. I think it's been 2 years since he was last here, Dr. Douglas Jones, yay, who is now an international expert. I think he was just an expert before, now an international expert on food allergies. Here to you to answer your questions. Dr. Jones, do you want to take a minute to introduce yourself?
Sure. Thanks, Joni. It's so amazing to be back with you. Really enjoyed our last conversation. And yeah, I'm a allergist immunologist, board certified, and started treating food allergies almost 15 years ago. And that kind of evolved into not only treating food allergies, but any kind of adverse reactions people are having with foods, whether it's sensitivities, intolerances, and then I've kind of dived a little bit deeper into gut health and microbiome, just because they're all really linked together. And I've had the opportunity of seeing patients from all over the world and speaking with in various countries on this topic, and it's absolutely a passion of mine. So I'm happy to be here.
And we are so happy to have you and appreciate that you're sharing your expertise with us. So, can you tell us a little bit more about your practice and if you work with adults or children or how your workflow happens?
Sure. So I'm in going to be in practice on on my own, our own clinic, and I see children and adults. So when you do board certification in allergy and immunology, you actually cross over into both children and adults. So I can see all of them, and it's fascinating to see the differences between what happens with children and what affects adults. So yeah.
So, our first question came in. Someone is saying they're in their 50s and they're wondering at what interval might it be worth getting retested for food allergies. It would be great to find another nut that they're not allergic to, since they've tested allergic to all nuts except Brazil nuts.
Yeah, so that's a great question. And one thing that I will say just up front is I'll answer all the questions just in a general sense because I can't give any kind of medical advice or it can't be taken as any kind of medical advice specific for any person. But in a case where somebody's older, been avoiding foods and not had testing for a while, I do think it's helpful just to get retested maybe every 1 to 2 years. Things can change. Um, but I will also say allergy tests aren't actually the diagnostic piece. There's a lot of false positives that can occur with allergy tests. They're not perfect tests. And a positive test doesn't necessarily equal allergy. That test has to accompany a history. And one of the myths or one of the problems that we have is too many broad panels of allergy tests being done and misinterpreted in a lot. And I'm not saying this is the case of the patient. Again, I'm just talking in general.
Mhm.
We have to be really careful with food allergy testing and who's ordering it, how they're being done, and how those results are being interpreted. Because I probably spend as much time undiagnosing food allergy as I do diagnosing food allergy.
Oh, that's so interesting. Yeah, somebody's asking the question like as you were saying it, so they probably missed your answer, so you may have answered it. But what is the best test for testing for food allergies?
As the basic tests that we look at for the traditional kind of what we talk about life-threatening food allergies are a test called an IgE test, not to be confused with an IgG test. Make sure we get our letters correct. So IgG tests are very common and marketed heavily as food sensitivity tests. There is no evidence to support their use, nor do they actually correlate with symptoms. Um, so I would avoid those tests. They uh, overall will not get you the answers that you want. IgE tests are the tests for food allergy. Um, and they can be specific, and it's a blood test. There's also some skin tests that can be done. My personal preference is more of the blood tests that look at IgE. With skin tests, there's just a lot of variables that can be introduced that can confound the nature of those test results.
A customer is saying soy is so common, it's in many products. Is a soy allergy common?
Yes, it's one of the top eight, nine, or top nine food allergens that we talk about. So soy is interesting though, because there's soy allergy, then we also may have some intolerances. And when you look at food labels, for instance, one of the most common things that we see on a food label is soy lecithin. Soy lecithin is an interesting thing because if somebody has a true food allergy, for instance, to the protein, they may look at a label and look at soy lecithin and think that they can't eat that. Um, in general, lecithin is a product where that protein has been kind of extracted. Um, and so you're left with just kind of the fat portion, really the unhealthy portion of soy. Um, but soy allergy is quite common.
So you mentioned intolerance. Can you tell us the difference between an allergy, intolerance, and a sensitivity?
Yeah, I would love to. So, a food allergy is where you're consuming the food and that your immune system gets activated. And that can actually create a potentially life-threatening type of reaction for somebody because it's going through the immune system and not just the immune system, but specifically through what we call an IgE mediated pathway, which is why we test the IgEs in food allergies. So it's immune mediated. The most common is going through that IgE mediated pathway. There are some non-IgE mediated food allergies that can also be life-threatening. That comes in the form of something that we abbreviate FPIES. That stands for food protein induced enterocolitis syndrome. That's a mouthful, but that's a specific type of, I'm just giving that as an example of a specific type of non-IgE mediated food allergy that can also be potentially life-threatening to somebody. But the most common is this IgE. Again, the activation of the immune system. With an intolerance, a lot of times what we're talking about is most of the time we'll see that as an where somebody has an enzyme deficiency, a digestive enzyme deficiency. So when they're consuming the food, initially it's not the immune system getting activated, it's they're lacking a digestive enzyme and they're unable to properly digest that food particle. And so then the food may go through the system undigested, causing gas, bloating, diarrhea, those types of things. So it's kind of a digestive issue. A sensitivity is more commonly how I think about it is if people have an imbalance in like their gut microbiome, for instance, or they have some gut inflammation, and they have this within the intestines, they can have kind of this increase what we call permeability. So usually the wall of our intestines is kind of intact. And how I like to describe it is if there's inflammation there, you may have it not be quite as intact. And so certain food particles can get through, again, not properly digested, leading to inflammation. And that can lead to, again, a lot of those upset stomachs, gas, bloating, diarrhea. Some people may have alternating constipation diarrhea. But the key is with sensitivity as well, because of that inflammation and because of what's happening there, you may also get symptoms of joint pains or brain fog or more systemic symptoms with that. But that's kind of the difference between allergy, intolerance, and sensitivity in just kind of a high level, broad view.
That was a great description. Thank you. Customer question: is there any connection between seasonal allergies and any particular food?
That is an awesome question. Thank you for asking that. Yes, there can be. So there is a thing called, it goes by several names, oral allergy syndrome or food pollen syndrome is the two common names that this may go by. And when you have seasonal allergies, for instance, to pollens, trees, grass, weeds in particular, you can also cross-react with certain foods, primarily fresh fruits and vegetables. So what'll happen is a lot of people may come in and they'll say, I can't tolerate these bananas or kiwi or avocados or watermelon, for instance. One of the key questions I ask them in particular is if they can't tolerate bananas, I'll say, but can you tolerate that in banana bread? So when that fresh fruit or vegetable is cooked or processed, and they'll say, yeah, actually I can tolerate it in banana bread, but I can't tolerate it raw. Or they may say I can't eat raw carrots, but I can eat them when they're cooked. Um, that is a classic case of like the food pollen syndrome or oral allergy syndrome. And what's happening there is the proteins in those fresh fruits and vegetables look a lot like the proteins in the pollens. And if you're really allergic to those pollens, when you're consuming those fresh fruits and vegetables, it's almost like it tricks your immune system. And your immune system thinks that you're getting exposed to those pollens, but you're not. It's actually the fresh fruits and vegetables. The reason those symptoms go away when you cook it is because when you cook or process that food, the protein changes. It's called denaturing. So the configuration of that protein changes. And guess what? It doesn't look like the pollen anymore. And so now when you eat it, your body's not recognizing it as such. And so you can tolerate it when it's cooked or processed. Um, so we see that quite commonly, and it's more common in adults because the more time we have to develop seasonal allergies and the worse they get, we can often see this crosstalk between certain fresh fruits and vegetables. I will say there's also some crosstalk between like banana, avocado, and kiwi with certain things like latex. So if you have like a latex allergy, that can also crosstalk with some of those foods. And so there's a lot of factors to kind of put into play if you start having symptoms to some of those foods. And then the last thing I'll say on that is you can actually have just straight up allergy to those foods without it being related to the pollen. And so it's important that you go see somebody that can kind of sort through that and help you understand like which category you're in and what's your risk.
Excellent. Then a customer is also asking if they have food sensitivities. Should they still be retested every few years?
No, not necessarily, because again, you may end up with a lot of false positive tests and kind of confound the picture. What I would suggest in that case is working more with your doctor or provider to work on your gut health and find out why are you having those sensitivities, and is there something more root cause that you can correct with your gut microbiome, your gut health, that underlying thing that can you reduce that inflammation to make your gut healthier. And then sometimes that helps correct some of the sensitivities.
A client is saying her granddaughter, age 4, has food allergies and eczema. Are they related? She avoids the food, but still has the eczema.
Yeah, they can be related. And if the eczema actually can put people at risk for developing food allergies. So when the skin, for instance, we have a barrier here that's intact, and that allows it's there for a reason. It's a barrier. If that barrier breaks down and we have, say, a patch of eczema on our skin here, when that skin breaks down, now that's an entry point. It's no longer that intact barrier, but it's an entry point for those foods. And so that can put people at risk for developing more food allergies. And so, and it increases the risk quite a bit. And so what we want to do is make sure that um, they're working with their doctor to keep that skin intact so that we're reducing that risk of developing more food allergies in that case.
Yep, we have a couple customer questions. I'm just gonna read through them. So allergies used to simply say strictly avoid after food allergy diagnosis. Can you share more about the newer allergy treatments or protocols that are available?
Yeah, I'm happy to. In fact, I helped pioneer a lot of these over a decade ago. And so we have many treatments now that we can take a more proactive approach instead of just saying avoid and carry your epinephrine injector and hope that you don't have an exposure. We can actually take a proactive approach in treating life-threatening food allergies. There's the term we use is immunotherapy, and all that means is it's a therapy that's going to change that immune system because as we said with food allergy, that's immune related. So we're doing a therapy to change the immune system called immunotherapy, and we can do that either through oral, meaning we're taking something orally, or we can do it through a version called sublingual, where you're putting certain drops under the tongue. And what we do in that case is we start with microscopic amounts of those foods that you're allergic to. And usually there takes a certain threshold by which the body is going to react to that food. We dilute those proteins down to microscopic amounts where it's under that threshold. And we start that introduction process, whether oral or sublingual, with actual food. You don't need pharmaceutical products. You don't need any of that. I often talk about let's go farm over pharma in this case, where we can utilize actual foods and do it in a calculated, methodical way. And this has to be done under the direction of a doctor or a provider that has some experience in this. But when you do the dosing at certain time intervals, frequencies, and the route, we can change that immune system. We can reprogram it, retrain it, so that now, instead of our immune system recognizing that as something as threatening or foreign, and we're creating an allergic reaction, we're building tolerance, we're inducing tolerance to that food, and we're raising that threshold by which somebody would react. And so at the end of it, people can be safe, from those accidental exposures, accidental ingestions of the foods. And in a lot of cases as well, if they wish, we can take their dosing even higher to where they're consuming that food and having it back normally into their diet. And we have well over a 92% success rate of getting these foods back into people's diets safely. There are some other treatment options, so that's kind of the immunotherapy route. There are some other pharmaceutical products that are now available that people can use. There's an injection. It's called omalizumab or Xolair is the name of the injection that's been FDA approved. And with that, people can get an injection, and they still have to avoid the food. But what it does is, again, it kind of alters the threshold to where they have better protection against accidental exposures. So that if they have an accidental exposure to the food, the hope is that they're not going to react severely to the food. So I often liken it to, if you're driving in a car, you have safety measures, which would include like a seatbelt and airbags. I kind of look at the Xolair omalizumab as putting a seatbelt on, and then you have your epinephrine injector in case you actually get hit. You have the epinephrine that you can use kind of like that airbag. So it just offers a couple of different layers of protection. So there are some pharmaceutical products that are approved as well.
That was a great analogy. I love that.
Thanks.
Can you recommend, if there are any vegetables, fruits, or other foods that are generally recognized as safe for everyone?
Oh no, I can't make a blanket statement that something's going to be safe for everyone. The moment I say that, somebody will raise their hand and say, "Wait, I know somebody that's affected by this." Uh,
Yep.
yeah, no.
Why do food allergies seem to be more prevalent now than when this person was a kid in the 60s?
I love this question. And really, there's a lot of things that can change our risk factors. And what's kind of led to this skyrocket of the epidemic now of food allergy. And most of those reasons when you see them listed as risk factors, it really comes down to what's affecting that microbiome that we're talking about, mainly within the gut. There's also a microbiome on the skin or the lungs. And so it's factors that are altering that ultimately I think of is the root cause of what's led to this sharp increase in food allergy. And then when you have that more the increase of not just food allergy, but allergy in general, that also changes the genetics. And so we have kind of this a greater genetic predisposition, plus a lot of these environmental factors that have led to the rise. What are some of the things that have led to the alterations of the gut microbiome? Pollution, our food quality, poor food quality, our standard American diet, for instance, just the poor food choices that a lot of times we make. Stress can alter the microbiome. Early use of antibiotics or antacids in children can alter that gut microbiome. C-sections, for instance, in children can alter that gut microbiome in an infant. Um, Vitamin D deficiency can play a role with our gut microbiome and how our body's responding. And so those are several things that we know are increasing the risk, but again, they all kind of come down to that alteration of the microbiome. And then again, the more this has occurred, the more it's in our gene pool.
So, having said that, that leads right into the next question. Are allergies primarily inherited?
Both. And the one thing that I'll say on this question is a lot of people think specific food allergies may be passed on. That's actually not correct. What is passed on is a predisposition for children to get allergies of some kind. So even if somebody has, for instance, environmental allergies to pollen, maybe it's cats, dogs, whatever, which there's also been an increase in those when you have that if the parent has that genetic predisposition, they can pass that on to their children, but it's not specific for specific allergies. So let's say if I have a dog allergy, I'm not going to necessarily pass on dog allergy to my child. Or if I have peanut allergy, I'm not necessarily going to pass the genetic predisposition for them to get peanut allergy. If I have peanut or dog or cat or whatever, I'm just passing on the genetic predisposition for that child to develop allergy of any kind, like in general, in the context of their environmental situation, what those triggers are.
And then somebody's responding to something you said previously, saying, so does that mean I might be able to eat avocado oil if I can't eat an actual avocado?
That's
Soy
a good
lecithin, I think.
Yeah, that's a good question, with the oils and it's not the same. I can't give a blanket statement, on all the foods and all the different oils, but in general, sometimes people can tolerate oils versus the actual food. Some cannot. That's why I can't give a blanket statement on that because even though a lot of the oils get refined and those proteins broken down, that's not the case for all oils. So that's one where, I'd have to say that's worth discussing with your own doctor and seeing what your situation is and getting their official recommendations on that.
Do you know if GLP-1 medications for weight loss help to heal the gut since there's less food eaten?
The GLP-1s could be beneficial in terms of, and there's some data on like low dose GLP-1s of having an anti-inflammatory effect. If people are altering their diet and doing things just in a more healthy way, uh, yes, theoretically that could help kind of facilitate the healing of the gut. I think it's going to be in combination of a number of factors, not just GLP-1 by itself. But I think it can be used as a tool to help get people healthier in general. And then that's going to help. And if we have, say, weight loss reduction, for instance, a lot of people may not realize this, but adipose tissue or fat tissue is inflammatory. So if we're overweight or obese, that fat tissue is just like this this mass of just sending out inflammatory text messages throughout our body. And so if we can just get that better controlled, whether it's the use of, dietary changes or GLP-1s, if we can reduce that inflammatory burden, then we're going to have a better chance of healing the gut and just helping us overall, whether it's with food sensitivities, intolerances, or risk of food allergy. So I think it can be used as a tool.
Yep, absolutely. Is it considered an allergy or an intolerance if a food item makes you vomit within 15 minutes of consuming it?
That's a good question. It could be either. It really, you'd have to have more of the context of the history there. But in general, if it's just vomiting and there's no other system involved, typically that would not be an allergic reaction. It still could be. Again, there's so many like nuances to context and history that you have to get. But in general, where if it's just in that GI tract, typically that would be more of an intolerance.
Can you talk about when a person has avoided a food and then accidentally ingests some of it and has a worse reaction than they've ever had before?
Yeah, that may just be the circumstance. Sometimes there's a myth that each reaction gets worse with the more exposure. That's not necessarily the case. When we ingest foods, that food is coming into the context of a body. And because at one point, a certain amount of food may trigger one reaction, another may trigger another type of reaction. But realize like that food is coming into a whole context. How much food is in your stomach? How much inflammation is in your gut? What's your stress level at the time? What time of day is it? Are you overly fatigued? For women in particular, what perhaps is your hormone cycle at the time? All of those things may play a role into how that body interprets that food as it's coming in and reacts. Um, and so just keep in mind there's a lot of factors that go into how our body's interpreting the food and then how it's responding.
Excellent. We have about 3 minutes. Another question. Do you have any tips or tricks for introducing allergens to younger siblings when their older sibling has a serious allergy?
I love this question. You got a really great audience, by the way. Like every single question has just been spot on. So I want to applaud this whole audience. You guys are fantastic. I love these questions. Um, Great thing of if you have older siblings with food allergies, in general, what you want to do is introduce, those foods. Usually starting at age 4 or 5 months, starting off with small amounts, 1 to 2 times a week, with that gradual introduction of those foods that are typically allergenic. If the there's concern, or if that patient has a lot of eczema, for instance, that's one where you may want to get in with your doctor and talk to them, because eczema, egg allergy, those types of things may pose a little higher risk, and then get some guidance from your doctor. But if you don't have those risk factors, if there's no eczema, there's nothing else going on, usually we just want to get those foods into the infant's diet, because the data is pretty clear and pretty strong now that early introduction of foods can help prevent allergy. And then obviously trying to, um, I would not introduce if they've just been on antibiotics, though, because that alters that whole gut microbiome. Or if they're on antacids, that's something where you're going to want to talk to your doctor about it.
And last question. Can gluten allergy be treated with immunotherapies?
Yes, it can. We've treated all kinds. So gluten, is going to primarily be wheat, barley, rye, oats. We've done immunotherapy for all of those. That's different than like celiac disease. So celiac is not an IgE mediated issue. So I'm not talking about celiac, and I'm not talking about like gluten sensitivity. But for true gluten allergy, yes, we can treat it with immunotherapy.
Excellent. Thank you so much. So we have 1 minute left. I want to see if you want to leave us with any words of wisdom, or, give them some tips for maybe, how to protect themselves if somebody has an allergy.
Yeah, I think the main thing is making sure you're seeking out good information. This is a space where there's probably more misinformation in the world than good information. So seek out good sources, people that are actually doing it, and also people that aren't just trying to sell you a test or a product. Because ultimately, with the misinformation, they try and scare a lot, and they'll fear you into over testing or over supplementing. And I would say just be mindful, get second opinions and seek out good sources of information on this.
So if you're a good source, how might they reach you?
Oh, go on my Instagram. It's just Dr. Douglas Jones, and that's probably the best way to find it. I teach all the time on Instagram about myths and different things, and we're actually going to be launching a campaign soon of more education. So go on my Instagram at Dr. Douglas Jones.
Thank you so much. We're so grateful for you sharing your expertise with us today on Table Talk. I appreciate all of you.
Thanks, Joan.
Yeah, have a great rest of your day. Bye, everyone.